Hi, my name is Porter McRoberts. I'm an interventional spine and pain management doctor here at Holy Cross Hospital. And this morning I wanted to talk to you a little bit about lumbar spinal stenosis. And it's one of those things that you may not even know you have it until you recognize the obvious signs of it, which are very specifically an inability to walk without your legs hurting or being tired. Well, I just can't walk. I got to lean forward on that shopping cart or on my walker because if I don't, my legs get too tired and I have to sit down. If you have difficulty walking because of leg pain, buttock pain, cramping, or numbness that increases as you walk or stand, that's relieved by sitting, with about a 95% certainty, I can tell you without an MRI, without any other clinical tests or lab tests, that you have lumbar spinal stenosis. It is a major problem. It's just like knee arthritis or hip osteoarthritis, except it's more common, more prevalent, and for the most part, our only tools to treat this problem have been simply epidural steroids, which work minimally, laminectomy, which works actually fairly well, but it's a large open surgery, and a lot of people are a little adverse to having a big surgery, especially as they age, in their spine. So what I'm going to talk about today is called a Superion interspinous spacer. It's a procedure that can be done outpatient. If you come in, the way it works is you would lie down on a table much like this one, and using a fluoroscope, that machine behind me, which is a video x-ray machine, I simply numb up the skin, put you into a flex position like you're sitting on the table, the same position that you don't have pain in. And then I make a little incision in the skin while you're awake and talking to me, and then I insert a spacer, and it unfolds inside the spine, and it's like a little jack, basically holding open the space in the spine to decompress the nerve roots, maintaining the same morphology and anatomy of your spine when you sit, when you stand. So it's simply just taking your sitting spine and holding it in that same position as you stand. And as you know, you feel good when you sit. That's the whole concept, is to decompress those nerves as you stand and walk, thus reducing the pressure on those nerves so that you have much greater walking tolerance. The principles of this are minimally invasive. You can go home or out to lunch practically after this. I want you to be inactive for a few days, of course, to let yourself heal. No time in the hospital, no need for anesthesia. You don't need to be intubated, you don't need general anesthesia. You really don't even need moderate sedation. We can do this while I just numb you up and we talk about your golf game. And you recover very quickly in about a week. 7 to 10 days, you're really doing pretty well. So this is the device. It's really just two sizes. It comes in multiple sizes, as so do people. And this is one of the interspinous spacers deployed. And you can see this is in the open position. As we stand, we're an extension. You can see it kind of like this. Our hips are back, and these lamina and these spinous processes are touching each other. And in so doing, it compresses not only the joints, but inside the canal where those nerves are coming from your legs, it compresses those nerves too. As we sit, our hips come up like so, and it brings our pelvis forward and our sacrum forward, and it simply opens up and straightens our lumbar spine, and it takes the pressure off of those nerves. The concept behind the spacer is simple. Simply implant this tiny little spacer between the two segments and hold it open so that when you stand and lean back, it preserves the same anatomy that you had when you sit at that level. You're looking at the MRI from what we call a sagittal viewpoint, which is just cut right down the middle, okay? So this would be the skin of the patient. This is the subcutaneous tissue of the patient. These are the spinous processes of this patient that in a very thin person you can actually feel or see. And then this is the ever important canal that houses and holds the nerve roots. And you can see there's the tip of the spinal cord as it should be. And then you see the nerve roots, and the white stuff here is the cerebral spinal fluid. And these nerve roots are the main communicators between your legs and your brain. And if they get pinched, as you can see right here, then as you walk, and you can imagine that curve getting worse as that patient stands and walks, it pinches the nerve roots. And the further the patient goes, the more pinching occurs, the more tired those nerves get, the more tired the muscles in the leg get. Maybe even they feel dead and weak. You sit down, all of a sudden you decompress the spine, let the blood flow back into those little nerves inside the spinal nerve rootlets, and the feeling comes back and you feel good. So in summary, it's a simple problem. Virtually everybody will get it if you live long enough. It's a major impediment to your ability to stay fit and active, which is the imperial exercise is the imperial medicine, in my opinion. If you can't exercise, it vastly increases your risk of death and disability and morbidity and mortality. So walking is key, and if you can't do it because you have lumbar spinal stenosis, you need to look for a solution, if not with me, with somebody. But this simple solution of the interspinous spacer going in between the spinous processes of the spine in a simple outpatient procedure that can be done in 20-30 minutes without any anesthesia seems to me like a very elegant solution. Thanks for your attention.